Good morning, everyone. Welcome to another AppSet Insight webinar. My name is Jackie. I'm one of the nurse educators from Insight here. And before we begin, I'd like to acknowledge the traditional owners and the custodians of the land and pay my respect to elders from past, present, and emerging. I would also like to extend that respect to any First Nation people who might be joining us on the webinar today. So today we have Associate Professor Kylie Lee from Faculty of Medicine and Health at University of Sydney to talk to us about Grog Survey App. So it's a survey approach that shows more updated data on patterns of drinking and drug use amongst First Nation Australians. Kylie is also the Deputy Director of Centre of Research Excellence in Indigenous Health and Alcohol. Her research in alcohol and other drug use is led by community and other health service requests. Kylie is the lead editor on a clinical textbook requested by Indigenous alcohol and other drug workers nationally, and then has been invited to assist Inuit and Sri Lankan communities in knowledge translation. So without further ado, everyone please welcome Kylie.
Thank you, Jackie.
No worries.
Morning, everyone. Thank you very much for having me. I also want to acknowledge that today I'm Zooming to you all from Wairwarung Wurundjeri land in the Kulin Nation down here in Melbourne, and acknowledge elders past, present and emerging, and obviously acknowledge that we're all sitting on Aboriginal and Torres Strait Islander land that was never ceded. And also I wanted to send an acknowledgement out to any Aboriginal and Torres Strait Islander people that might be joining us here today as well. Okay, as Jackie said, I'm going to be talking about a project that we've been, a body of work really, that we've been doing since 2014, 2015. And it's really hard to tell the story without kind of acknowledging the really amazing collaborators and project team who have worked on it. So you can see their faces and their names here. Some of the analysis that I'm going to be talking about today, particularly in relation to the validation of the Grog Survey App, was led by James. So a particular shout out to James, and red box to show you all who he is. He's amazing. So just to give a bit of an overview, so what are we going to talk to you about? And I'll just kind of step through. So we've got a bit of a recipe or a roadmap. So I'm going to kind of start to talk about, where does the story start? Why do we need to do this? So what are the particular challenges about asking about drinking, which we're trying to address via the app? And then I'll take you through a little bit of a test drive through the app. So what is it? I'll show you some of James's analysis. So what difference can it make? And then where to from here? So what are the next steps? And I guess the whole story is about just trying to make a pitch that we really need to rethink the way that we are asking some peoples about their drinking. And we're using the example here of our work with First Nations Australians. So where does the story start? The Grog App story certainly starts with Scott Wilson. Some of you may know he's an adjunct associate professor at Sydney Uni, but in his day job, he's the CEO of the Aboriginal Drug and Alcohol Council of South Australia. Scott conceived the idea for the app when we spoke about it in 2012, actually. NIDAC is the National Indigenous Drug and Alcohol Conference. Scott and I were in the last resolution session, they often have at the end of conferences, and he was kind of talking to me about the disconnect. He said, what I see and what community sees on the ground, and in his case in South Australia, is just so different to what state and national surveys see if you look at the prevalence and impact of alcohol and other drug use. Yet being a CEO of a community controlled drug and alcohol service, he's very aware that, of course, government needs to use such data, such as state and national surveys like the National Drug Strategy Household Survey, for instance, to inform the funding that they give on the ground through states, territories. So he was like, you know, can we do it better? And for him, being a drug and alcohol services, can we do it better for First Nations Australians? So Scott has very much led the way in terms of trying to look at various technologies to work with First Nations Australians to raise people's awareness about harms from drinking and other drug use, to get people to understand standard drinks, that kind of stuff. They've developed apps previously. So we decided to kind of talk with Professor Kate Conograve, who I work very closely with at Sydney Uni, and to get a team together to apply for some NHMRC funding. And we were lucky enough to get that funding. So the project grant that actually just ended last year started in 2015. So this is kind of the backstory to the app that I'm going to show you a little bit later in this talk. So that's kind of where it started with Scott, but I kind of thought it would be useful to fill in some other gaps in terms of reasons to do this research as well. So you guys would all be aware that alcohol is the biggest cause of years lost to illness or death for young adults. This is particularly relevant for younger populations, and First Nations Australians are one of those populations with a median age which is much younger than other Australians. But in the case of anyone, it can be really hard for people to describe their drinking. And I'm going to talk to you about some of those challenges now. More so, one of our collaborators from the National Drug Research Institute, Tanya, was saying her research has found that when you look at Aboriginal and Torres Strait Islander people's drinking, their drinking has been shown to be out, as in underestimated, by up to 700% for women and 200% for men. So there's no wonder that what Scott's seeing on the ground when he's looking at services and programs being funded, for instance, in South Australia, that he's just not seeing the level of funding for the need that the community is experiencing. So how could we get a clearer picture of drinking patterns amongst First Nations Australians? Scott is a visionary, amazing guy. He always wanted to, he dreams big. He always wanted to add in other drugs. We had wonderful collaborators such as Professor Robin Room at La Trobe University at Centre for Alcohol Policy Research, and Robin was very much saying, just do one at a time. It's going to be really hard to validate multiple drugs at one time. So we heeded Robin's very wise advice, which he always gives. And so what I'm going to talk to you about is the Grog app, which measures drinking only. We do that by asking about how much people are drinking, so consumption, dependence. So again, on Robin's advice, that was using the 3 ICD-11 criteria, simply because it was just shorter, less items to ask about compared with DSM. Asking about harms to self and others, treatment access, and we also give a tailored feedback at the end, and I'll show you some screen grabs of that and talk to you more about that when we test drive the app. In terms of how we measure consumption, so how much people drink, we're using a modified audit C, modified because it's visual. So instead of saying I have 1 to 2 standard drinks or 2 to 3 or 3 to 4, etc., the app will ask you what your preferred beverage is and then show you those response categories in terms of the amount of beer or the amount of wine for the various response categories. We also ask timeline follow back, use a timeline follow back approach. So this is about kind of having those soft landings and making it comfortable for people to start thinking about their drinking and reflecting on it. And I'll show some slides that indicate that as well. And on Robin's advice, we use the finish method, which is the last 4 occasions method. So asking about the last 4 occasions, what people drank in detail in the last 12 months, and of course, when people drank in the last 4 times, so the date of drinking as well. It's been really useful, or it's been previously shown as a useful method for populations which tend to have more episodic drinking. So populations where perhaps people aren't drinking every Friday night, every Saturday night, or they're not having a regular kind of, there's no regularity to people's drinking. And our First Nations Australians collaborators seem to feel like that was certainly the case when we're looking at drinking, the range of drinking patterns amongst First Nations Australians. Also, we wanted the app to be flexible. So we wanted to add in stuff about drinking, but maybe later on we or other researchers, because the app's available as a private download on the App Store, maybe other people might want to ask about heart disease or about exercise or environmental health and that kind of stuff. So you can also add in your own custom questions as well. So why is it hard to ask about drinking? We decided to kind of get deeper in this by sort of, before we got the grant, sort of by writing this commentary paper to Drug and Alcohol Review. And we kind of summarized that there are really 3 different areas in why it's hard to ask about drinking. And for us, we're looking at national surveys, because if you remember, Scott is wanting to kind of have a more clearer picture of drinking on the ground, because that's used to inform government funding. So we're really wanting to look at drinking on a population level or in a community. So firstly, in terms of how those surveys sample, people need to be having a fixed address. They can't be living rough. They can't be couch surfing or in temporary accommodation, hospitals, prisons. And because it's national, they have an amazingly hard job to do, the national surveys. So understandably, there's very small numbers of Aboriginal and Torres Strait Islander people who are sampled, who actually complete the survey. Yet one of a meta-analysis that James on our team, James Connergrave, led a few years ago now, showed that drinking varies so greatly amongst Aboriginal and Torres Strait Islander people, not only within communities, but between communities. So if you've got a sampling approach that's sampling a really small number of Aboriginal and Torres Strait Islander people, it raises question marks about if it's reflective of what's on the ground. Also, in terms of survey administration, as you would all know, these surveys are often like the census that we all fill in every few years. So if you're not comfortable with English, or if you have other sort of culturally and linguistically diverse, then they can be barriers to people answering the surveys, particularly if you've got, answer question 1 and skip through to question 26C, that kind of those sorts of very common instructions that those surveys will have. And I think there was also troubles with confidentiality in terms of what the surveys are asking are very sensitive and they're very personal in terms of alcohol and other drug use, and certainly other drugs in terms of illicit drugs, that's even more sensitive. So there were worries there around confidentiality and what that data might be used for. Could it be linked back to people? In terms of survey items, I'm going to go through now. There were just so many disconnects in terms of how to ask about drinking that would be suitable for various Aboriginal and Torres Strait Islander peoples, but there were just so many obstacles there. So the first one definitely is just, how much is a drink anyway? So people drink from a range of containers. You might know that the way surveys ask is that they generally ask about, the small wine glass or the nip of spirits, and then the standard containers that beer might be sold from, that kind of thing. Yet that's really challenging when people drink from a range of containers, including non-standard containers that alcohol might be siphoned into and then shared amongst a group, for instance. So this is a guy who one of our collaborators saw at a community controlled health service. He comes in and one of the other staff are asking him, how much do you have when you drink? I have 2 drinks and I drink wine, but he keeps coming back and he keeps coming back. So eventually he kind of gets to see our collaborator. This is Professor Kate. And it turns out that he just keeps coming, and she's worried because she can see harms and she senses that there's a deeper story there. So she asks him, John, what do you drink out of? And it turns out that he's actually, the wine is being poured into a full sports bottle. So obviously the earlier workers weren't that worried because it was 2 drinks of wine and they'd kind of assumed that it was just that small kind of wine glass. Yet he's actually having many standard drinks that was kind of measured with the harms that they were seeing that he was presenting with. and just that people can be drinking from a range of containers that are not necessarily on those typical standard drinks guides. So including those sort of repurposed soft drink bottles, etc., or even straight out of the silver pillow itself, the cask. In terms of some other challenges, and this is not specific to Aboriginal and Torres Strait Islander people, it's certainly specific amongst my friends as well. You know, many people don't know how much a standard drink is, yet all surveys will ask you those standard quantity frequency measures in terms of, you know, how many do you have, and how often do you have those? And it's really hard to answer it if you actually don't know how much it is and you're not sure how to do the maths. As you would know, the maths change for various types of product as well, various beverages. In this community, or in these communities in terms of First Nations Australians, sharing can be really common as well. Yet the existing national surveys, there are some community surveys that ask about sharing, but the national surveys don't have the facility to ask about sharing. And that might be that a person might actually remember better that the whole group bought 2 slabs, and then my portion was, you know, an equal share of how many people were sharing. They might, you know, some people do feel it easier to estimate it, their share from the group, as opposed to just focusing on themselves as an individual. The other thing is timeframes. As you know from all of these surveys, we're asking about some kind of particular behaviour. So in our case, drinking, but we want to know about a particular timeframe. So for us being trying to do a population survey, we're after last 12 months. But what about if people, you know, their everyday life, they don't actually use those sorts of timeframes? And certainly when I've lived remote, there have been communities which have marked time according to various seasons, and it's not just wet and dry. There are lots of different types of seasons that come in amongst the wet and dry as well. So we really needed to do better in terms of trying to make it easier for people to answer questions about how much they're drinking, not only in terms of how much, so the standard drinks, accommodating for sharing, as well as really helping them understand the time frame that we're after. Otherwise, the responses they're going to give to us are going to be very mixed and likely not usable for us. We had a big forum that brought First Nations Australians, health professionals, so through from clinicians, drug and alcohol workers, health promotion people, etc., as well as researchers and the investigators on the Grog app study. And the First Nations Australians collaborators were very clear that you just couldn't assume that there was a one usual drinking pattern for many people. As an academic, being a bit cheeky, I did ask one of our key First Nations collaborators who was presenting on this to the group. I said, what about if I just change the word to typical or some other synonym? And he was like, gave me the Chinese death stare, and he was like, no, it's just, you know, you can't assume that people are drinking. Drinking changes for so many people, not only in remote, also in urban, depending on many different factors, who people are with, how much money people have, what sorts of events or festivals are happening at the moment, etc. Yet, as you would know, people are asking, you know, how often do you drink? Daily, monthly, weekly, etc. And we are all asked to sort of fit ourselves in a box. But what about if you can't fit the box? And therefore, which response category are people gonna fill in? For those collaborators, First Nations Australian collaborators, also talked about, you know, cautioning us, saying that we really needed to be careful about how we're asking the questions, because there's a lot of, you know, actual racism that people are experiencing. There's a lot of shame around drinking, and understandably, when people are answering the questions, therefore, because of those structural factors and negative experiences, you know, there's something to be said about, you know, being labelled as a drinker, or are you something? So we really needed to to take a really mindful, active, mindful approach around making sure that people could feel supported to be in a safe place where they could describe their drinking and that they didn't need to be shamed about it either. As I mentioned before, when we were talking about some of the issues with the existing surveys, there were worries about confidentiality, and that came up again through our kind of scoping around what we should do. So really being sure that no names or other personal identifying information is collected on the app, and being able to say to the person, yeah, we collect the birthday so that we can put it, so say the 1st of October, so we can put it on a diary to help people remember, but we don't collect the birth date. No names are collected, and even as soon as someone enters their answers in, they can't be retrieved by the person who's on hand to the research assistant or research officer who's there. So that's some of the backstory, the challenges and the reasons why we designed the app. And I just wanted to take you through a bit of a test spin of the app, but also thinking about now you have an understanding of some of the challenges. What are some of the principles that we wanted to take through to the app and some things that we were hoping to achieve? So I mentioned the forum that we had a lot of consultation and research, talking with First Nations, Australian health professionals and community leaders, etc., around the country. But we also needed to work out and to be sure that we had a good handle on how existing surveys ask about drinking. So validated surveys, non-validated surveys, screening tools as well, like audit, etc. So just we needed, and community surveys as well. So great surveys that Ernest Hunter has used up in the Kimberley, that Alan Clough has used up in Arnhem Land, single community surveys. We kind of had a great look through all of that just to check that we weren't reinventing the wheel, and that we can bring the best and then sort of work out what was going to be good for this app. Then we went through a period of development, and we did that with an external app company, of course. And then we tested it in 4 communities, which is the validation study that I'm going to be talking you through. And then we refined it. I'm going to show you, which is the blue box. We're going to show you a little bit of the blue box. And that was great because it meant that we could shorten the survey. We could also think about what the participants from the validation study and what the research assistants said, the things that were a bit annoying, the things that kind of were a bit confusing. We can refine it. And then the gold box is testing it in 2 more communities where we actually tested it as a practical survey tool. So thinking about how it would function if this was to be just any other survey just to measure drinking. And that was by recruiting a sample of 2 community representative groups of people in one urban and one remote site. So I said before I take you through a bit of a spin through the app, I wanted to talk you through a bit of the process for how we developed the app and some principles. So the key principles in terms of what we really wanted to achieve with the app is that it needed to be suitable to First Nations Australians. But the tall order is that, across the country, whether you're in Broome or whether you're in Redfern. So 16 years and older, we did that just from an ethics perspective. It was easier for us. But particularly it needed to be comfortable and easy to use for people with less access to technology or just less comfort with technology, including, grey-haired people as well. As I mentioned before, it had to suit a range of contexts. So people that might still speak their, babies coming out speaking Aboriginal and Torres Strait Islander language, or people in urban right through to more isolated communities. In terms of the words that were used on screen, the audio that you can hear, and the pictures as well. And a really interesting kind of discussion that happened from the forum was we were talking about, would you have hand-drawn pictures of grog, or would you have, actual pictures of a VB can, actual pictures of cask wine, box, and the people that had worked in particularly remote areas, not just in the NT but from WA as well as Queensland, were saying that, you know, for them you'd really want to go with the actual picture, because some types of alcohol, the more remote you go, might just be known as green can, for instance, in the case of VB. So we needed to be really careful if we used hand-drawn images in relation to alcohol. I talked before about shame and also, I guess, talking about judgment. So we really wanted people to have a comfortable place to tell their drinking story or their non-drinking story. We didn't want people to feel judged. We didn't want to straight in go in and say, so how much do you drink? Tell me, tell me. So you'll see through the app, we have what Rob Assan, a wonderful alcohol and tobacco, other drugs worker in Queensland. He's a big collaborator with us, and he talks about these soft landings. So really trying to create a space so people can feel comfortable. And obviously what we were trying to hope with the validation study is that we're doing it, you know, ideally people would be talking to a clinician to kind of tell their drinking story. And when Rob or when Professor Kate, when they're there with their clients, they can beautifully pivot and be empathetic and stop and ask a different question. They don't need to ask it the same way. But we wanted to do it on an app. So we really needed to think carefully about how people could feel like they weren't being judged and feel like they could just, the story could unfold. But obviously the order of questions that I get would be similar to or the same to someone else. It needed to work offline. So you need the internet to download the app onto the iPad. But once it's there, it'll work offline, which is really important, not just for remote settings, but when you're, you know, when you're anywhere where the internet is just a bit variable or just kind of a bit clunky. So that was a great pickup from Scott and Jimmy from ADAC, the Aboriginal Drug and Alcohol Council, with all of their work through remote areas. So they were just like, yeah, it needs to work offline, which has been certainly maximised its usability. For people, as I said, not just Sydney Uni, but other services can subscribe to use the app to collect their own data, and also communities have expressed an interest in doing the same. So we've got an inbuilt function so that people can get a de-identified summary of people's completed surveys, so that, you know, after a certain number of minimum surveys are complete, you can see, oh, in your community, people are drinking, you know, on average 8 standard drinks per occasion, and they're, you know, you can get just a bit of a summary of how drinking looks. This was really important, and it's something that I'm hoping to refine as time goes on, because I think it means that so often communities are, they might not have the workforce or the infrastructure to collect the data or to analyze the data. Like you need someone like James to do it, for instance. So we're really trying to work to try and, you know, really give as much of that power back to communities, so that they are the, you know, the masters and mistresses in terms of being able to monitor drinking in their community. And then communities can use that to inform local efforts as well around prevention and treatment. And as I mentioned before, we did a big scope of the existing surveys and screening tools. And Robin's sage advice was, you know, you really need to be comparable with some of them. Otherwise, you're collecting data on this app, and it's not clear in the literature how you're comparing the drinking data collected on the Grog app with audit and with other existing tools that are commonly reported on in the literature. So how does the app work? So this is the first page. We have a demographic section at the start that asks people how old they are, what sort of school and training they might have had, what sort of, and those sorts of questions at the start, more demographics. This is the first question in terms of the alcohol section. I'm just going to move my Zoom screen down here so I can see. So you can see here, you can change the audio. So there is a female voice and a male voice, and at this stage we have tested it just in 2 languages, so it's plain English and Pitjantjatjara. We chose Pitjantjatjara because it's spoken across across a few states and territories. So WA, SA and NT have that common land between those three regions of Australia have Pit speakers. And it's also a language where, you know, babies still speak. They teach Pitjantjatjara at university. So it meant that we could have access to really a plethora of translators as well to help with back translation and that kind of thing. What you'll see when you go into the app, Talia, who's our wonderful research assistant, she's got these screen grabs for me. So she's obviously selected that she's a woman. So she's, so now we'll see pictures of women throughout. If you said that you're a man, you'd be seeing pictures of men, younger men right through to older men. I mentioned before about the timeframes. So we're particularly interested in the last 12 months, which is what a population survey would do. So Talia clearly got this screen grab around the time of the, you know, September-ish, the AFL NRL grand final, because it's asking the person, you know, have you had any grog at all? I'm talking about in the last 12 months since that AFL NRL grand final. So if I was to do it now, it would say since Easter last year. So we have 4 anchor points, if you like, and they dynamically change according to when the person is filling it in. And obviously this works when you're not connected to the internet as well. As I mentioned before, there can be a lot of stigma around drinking in some communities. Just moving this down, sorry. So if on the previous screen, if someone says no, because I think I'm not a big drinker, I haven't really had very much to drink, we're asking this check question as well, which is something that Rob Hassan and Professor Kate and the other clinicians and drug and alcohol workers that we talked to said that they would typically ask. So how about at, you know, the grand finals or at, you know, at weddings or funerals, have you had any grog at all? And it just gives that additional kind of thinking point, because the person might just have had a drink on their birthday, so they don't really see themselves as the drinker, but they did have one drink. So in that case, they'd click yes. And we go into, now this is like drawing inspiration from timeline follow back. So instead of asking straight away, so tell me, what did you drink? What did you drink? We're going to kind of ask them about where you were and how many people you were with. And then they're going into telling us about their drinking in that last day. As I said, we're looking at the finish method. So asking about the last 4 times people drank in the last 12 months. So this is, if you like, the main grog shop. And as I mentioned, we're using actual pictures of products. These products change. So if I set up the survey as saying that I was from Queensland, I would be seeing mostly 4X beer. If I was in NT, it would be mostly VB, etc. So you can change which pictures appear, and that particularly changes around beer, according to what state you're in or territory. I mentioned before that there's a range of containers, so we're not making any assumptions here about how people are drinking, what they're drinking and how much they're drinking. So I can choose to do a water bottle or a repurposed water bottle. I can fill it up with my slider up and down. In regards to some feedback we got after we did the validation study is that, you know, often people might be adding in juice or fizzy drink. Just say if I've got Jim Beam and I want to add in Coke or something. So they really wanted this feature added in because I'm interested in the alcohol content, but they might be thinking, oh, well, it was full and I had, you know, it was full up to here. And I had Jim Beam, but then we're basically asking them, you know, but how much of that was Jim Beam? Because that's really what we're interested in. And then in the back end, the app is able to calculate of the alcohol content that you've put in, this is how many standard drinks. And it kind of, it can calculate that at the end when it's giving people feedback as well. And then, of course, you can say how many you had of those as well. You can put it up and you can pull it down. If this amount that you've put into your drinking cart is more than 7 Australian standard drinks, then it is going to ask you a question just to check. So it's going to say, you know, is that what you had or what the whole group had? And I could say it was the group. And then I can, it's going to give me, according to how many people I put in my drinking circle back at the start, it's going to give me an equal share. So I can kind of say that I was a bit greedy and I had a little bit more, or I had a little bit less. Another thing that that often the other surveys, the national surveys, aren't able to collect is asking about dry patches. So it's important to know when people are drinking, but for episodic drinkers, it's particularly important to know about periods of dry patches where people aren't drinking for whatever reason. So again, using the same anchor point, we're asking people, have you had any time when you haven't had any grog at all? You know, we're interested in the last 12 months. So if this is actually technically 11 months and 3 weeks that we're interested in, and then you can pull the slider up to show how long you had. And that was really important because from the prevalence study, we actually found that women were having a median of 90 days dry patch in the last 12 months, and men were having 60 days. So it's a really long time of dry patches, and it's important for clinicians to be able to kind of factor in the dry patches as well as the drinking, as well as the harms, as well as dependence. So you're getting this really rich picture of someone's drinking, and then you're able to kind of give a brief intervention that can advise accordingly. We ask about dependence, which I mentioned before. So this is just one example. And you can see here that the background color has changed now. So it's clear to people that we're in a different section. Jimmy Perry, wonderful Jimmy from ADAC, who works with Scott, was kind of saying, you know, can you make these response categories a little bit easier to be sort of that plain English? So he said, you know, what about once in a blue moon? We still have the words underneath that audit and other surveys might have, so hardly ever, less than once in the month. But the first thing they see is once in a blue moon. And of course, the audio track will read all of the response categories as well as the question out to you. When we put in the application to NHMRC, I'm embarrassed to say we didn't say that we would do, we would feed it back. We didn't say that we would give tailored feedback. It was very much focused on trying to come up with this validated survey tool. As soon as we, you know, started working, you know, we knew straight away that we couldn't take people's survey answers and not give them any immediate feedback as well, and tailored feedback. So we were lucky that Kate, Professor Kate, is a addiction medicine and public health physician, and she has done work for WHO before around alcohol brief interventions. So we were able to take a WHO adapted, so World Health Organization adapted brief intervention, excuse me, and which had already been adapted for an urban Aboriginal and Torres Strait Islander population, and adapted again to be a bit more app friendly, interactive, etc. So it's based on flags, so feedback, listen, advice, goals, and strategies, but with the help of Elizabeth Dale from the University of Wollongong, and with Kate and with Catherine Zeng from our team, we're now updating it. So it uses flags as well as the social and emotional wellbeing model from Pat Dudgeon and team to help explain the story of drinking and how it might be affecting people, not just for themselves and their body, but also in terms of country and spirit and mind and family and that kind of thing as well. So the first thing it's going to do is place you into this risk triangle. And obviously some people that we met didn't drink at all. So they would be down here, or they would be, you know, very, very light drinkers. And they would still get the information. They don't need to read it all. But in case, we used it as a health promotion opportunity in case they were worried about other people, or they were just interested to find out more about drinking. And then it gives you a range of tips. So there are many other screens in here, lots of different user journeys depending on where you fall in that drinking triangle. But this is some examples on tips if people do want to cut down, like not drinking every day, just drinking in a couple of days, and having food as well as drinking, the sort of standard stuff that a drug and alcohol clinician would tell you. As always, I've spent too much time doing the demo mode, so I promise I'll try and wrap up soon. So what difference can it make? And this is really using some of James's analysis that he led with us. And this is the publication that these analyses come from. So what we were really after is that finish method that I told you about, where you're asking about your last 4 drinking occasions in the last 12 months. Can that deliver an accurate kind of picture of people's drinking when we ask it on an iPad? So what we did is we asked 200 people. 100 of them were in Queensland in an urban setting, and 100 of them were in a combined sort of remote and regional setting in 3 different communities in South Australia. The South Australian site was there because some of those people speak Pitjantjatjara as well. Because it's a validation study, we wanted to test that the app could be sensitive enough to pick up lots of drinking patterns. So we're talking non-drinkers right through to people who might be dependent. Social drinkers for us are people drinking within the national guidelines. Everyone did the app, but everyone also did a clinical interview, which is our gold standard. We deliberately chose it because we wanted to choose it. We wanted to compare the app with what might be available in communities around the country. So whether you're in Melbourne or Sydney or Brisbane, or whether you're in a really remote spot. So we're comparing it with an Aboriginal health professional doing it, not necessarily an Aboriginal drug and alcohol worker, because not all communities have them. And some people did the app first, some people did the interview first. So that was kind of randomized. And then to do the retest reliability, people would then do the app again. And they would redo it again within 2 to 7 days. And the reason for doing that is because we were guessing or hypothesizing that people's drinking might change if it was more than that 7-day period because of paydays, etc. So, and also for us, it was just easier to find people faster than having to wait longer. But we figured that their drinking patterns would likely change if we went beyond the 7 days. So as I said, we're comparing the last 4 occasions method on the app with a 2 to 4 week retrospective diary. We chose this because drug and alcohol clinicians such as Professor Kate and Rob, etc., they said that this is how they would generally ask about it, where you're going back and asking about drinking in the last 2 weeks. If they've had none, then you go back to the 2 weeks beyond that. But of course, we had to match the reference periods for each of them. So we're looking at this diary, we're looking at the dates that they enter here, and we're trying to match it. So when we look at the percentage of drinkers classified at, we've got short-term risk, long-term risk, and high risk, what we can see is that they're very similar in terms of short-term risk, in terms of the app and the interview, which is kind of what we were hoping. And again, here you can see that, so this is the proportion of people who drank in the past year, slightly higher on each occasion on the app. So 18 median drinks. This is actually meant to be per occasion, and per day was much less, which is what we would see in a community that has much more episodic drinkers. In fact, the app, if you look at any type of risk, the app and the interview had a good agreement, so 78% of agreement. Interestingly, when we looked at consumption, so how much people drink recorded on the app versus tremors reported on the app, you can see that the app was actually a better predictor. So consumption as measured on the app correlated better with tremors than consumption recorded by the interview. So that was great, because you're comparing the last 4 occasions data in terms of what people are entering into their drinking diary with what they answered on a different variable in terms of the tremors in the dependence criteria. So it was good to have that additional layer of it meshes, it makes sense in terms of correlation. And when we look at the retest reliability, so again, this is 2 to 7 days later, there was a great correlation there between what people were entering on the app the first time and what they were entering on the app in terms of their alcohol consumption, dependence, etc. The second time. So I'm going to zoom through some of this because I know I'm running late. I'm sorry. So in terms of acceptability and feasibility as well, this is the paper. You can check it out later if you're interested. Just 6 people out of those 200 that we talked to found it hard to use. They were typically, white-haired older people in the community. Some people felt like the last 4 occasions was just like groundhog. If you can imagine, tell me about your last occasion, mark it on the diary. They enter what they drank. Tell me about the occasion before that, occasion before that, occasion before that. So we really needed, that was confusing for people. This was definitely the biggest kind of thing that we needed to kind of solve with the collaborators. But then there was some good stuff where people just literally would frequently say to the RAs, the research assistants, I just didn't know I was drinking that much. And in fact, more than half of the study participants said to the RA that the app had made them think about their drinking. And that was really startling to them, because these research assistants know how sensitive it is to ask about drinking, yet people were actually wanting to talk about drinking with them because the app kind of was a safe place that kind of made them just an opportunity to reflect on drinking, not only for themselves, but also for family members or other loved ones. But the Groundhog Day. So we really needed to work out, could we ask about less occasions, basically? So we wrote about it in this paper, and I think you can get the slides if you're keen to get the paper later. This is an open access paper as well, so you can just get it online for free. So I'm going to move this up just to explain. So what we're trying to work out is the number of occasions that we use to estimate how many. So you can ask about the last 4, the last 3, the last 2, the last 1. And here we've got the number of occasions we use to estimate frequency. So we're asking about the last 4 occasions, or do you ask about 3, 2, 1? So what we found is that if we asked when, so the date of when people drank the last 4 times, but if we just asked in detail about the last 2, we would still have, very little variance. So we'd still have 99.7% accuracy compared with asking about the last 4 times when people did drink and in detail. So you can see 100% down here is what we went in and asked on the validation study. And we're really losing very little if you're asking about the last 2 times in detail about what people drank, in terms of I had Jim Beam, I had a slab of beer or whatever. We didn't want to go down in terms of frequency or down further in terms of the last 1, because you can see a bit of a dip to the 96%. And that's because we know that drinking can be really variable in First Nations Australians. So, and because of that, we can have heavy drinking days, lighter drinking days, and that might not fall within just that last occasion. So a little bit risky for us to go down to just asking about the last 1. So now the app asks about the last 2 occasions in detail, but it'll ask you about the date of the last 4. I'm sorry for doing my fingers. It just helps me, helps me remember. Okay. So to summarize that, drinking occasions didn't vary greatly within person, and we found that fewer occasions could certainly accurately summarize most people's drinking, acknowledging that it's just a diversity of drinking patterns out there. So where to from here? So we're lucky, we're now extending the Grog app to other drugs, so tobacco and illicit drugs. And that's with an ideas grant that started last year. So it'll still have the same flexibility with custom questions, etc., but you're going to be able to ask about 1 or more drugs. So you might be able to set up the survey and just ask about alcohol and cannabis, or alcohol and methamphetamines, or you could ask about every single drug that's in here. So also adding heroin, painkillers and benzos. And then the app will, with this new phase, which is what we're calling the drug app, the app will also be what we're calling platform agnostic. So it'll work on an Android tablet, it'll work on an iPad, but it'll also work on a laptop or a desktop. And that was really important because I've been thinking about, you know, studies that might work with secondary students, say in a computer lab, that kind of thing, where they could still have their headphones on listening to it, and just having a different measure to be able to collect drinking data, which doesn't rely on people doing the maths and working out standard drinks and that kind of thing. I think it would be really interesting. So I wanted to step back and think, you know, what can we learn about measurement of drinking from what I've shown you today on the Grog app? So I think it's really important to remember that not everyone has a regular drinking pattern. The tools ask about regularity of drinking. So I would really argue that tools need to account for this when they're asking about drinking. Otherwise, you are just forcing people into a box that might not fit that well for them and might not be reflective of their unique drinking patterns. For instance, you know, someone said they might drink 10 drinks a week. So if you're thinking you've put them in the frequency box, say I drink monthly or I drink weekly, and then how many do you normally drink? 10 drinks. But that could be, you know, 10 in one day, it could be 1 or 2 each day. And that's very variable when you're looking at that spectrum of drinking. It's very variable in terms of how of the harms that might be experienced by that person. And we'd argue that these detailed sort of patterns of drinking is also just so useful to inform clinicians and health promotion responses as well. In one of the communities that we met in the prevalence study, you know, people were only drinking a particular type of beer, or they weren't drinking wine, they were only drinking a particular type of spirits. And it means for that local community, when they're targeting their health promotion response, they can do it in a really meaningful way, because it's going to be directly reflecting back the health promotion messages based on the types of products or the type of beverage that the community is saying that they drink. So just to summarize, the Grog app can be used by communities and services. And it's really to help them monitor and reflect on their drinking. It has been designed as a population survey tool, like a household survey. The development of the app was led by First Nations Australian clinicians and health services and communities. But at the moment, you do need an iPad, but the Grog app will work with, will be platform agnostic, as I mentioned. It's available as a free private download via USID's app store, but just privately. So you just email me if you're keen to have a look. And there are 2 versions there. So there's what we call the demo mode, where you take it for a test spin or a health promotion, where someone can fill it in, but no data is being collected. Or there's also a data capture tool where you need to register and subscribe and that kind of stuff. And our team can help explain that. Certainly, I think for me, the benefits of that, it can work offline, and having assisted with data collection in the prevalence study, that was just so useful when the internet cuts out. It was, you know, we really wanted to make it flexible and customizable. So not only can you add in custom questions, but if, you know, I've got I've got researcher friends who are really keen to look at the app with culturally and linguistically diverse populations. So in time with the Grog app, they'll be able to sub out the pictures that I've shown you today and put in pictures reflective of whatever community where they're going to be data collecting from, and similarly put in the associated audio. I think for me, and that's why it's so wonderful working with Scott and Jimmy from Aboriginal Drug and Alcohol Council and Noel from Inala Indigenous Health Service. It was the beauty of the app was all of the groundwork that went in at the start and throughout the development. So it was a very iterative development process. Like I kind of can only sort of mean it's just like this circle where we're constantly checking to ensure that it can meet for the target pop, because really we're wanting to target to the most diverse group of Aboriginal and Torres Strait Islander peoples across Australia. And I think it's really interesting to think about how the app might go to use with other priority populations, as well as with a screening tool. So other populations where there also might be stigma around asking about drinking, it'd be really useful to see, can it transfer to other populations and how it might go. This is my last picture, last slide. It was more just to show that iterative co-design was just such an important part of the app development. And I think I think we all know it, but it just takes such a village to do good research and to do it in the right way, where it kind of meets community need, it meets clinician need, it meets, you know, research need as well. So very grateful for these guys, as well as for the investigator team that I showed you at the start of the talk. Anyway, that's me. Thank you very much for listening.
Thank you, Kylie. That was quite thorough. We've actually got a few questions from the audience. One of the questions was, early on, you mentioned that the concern of the service having too many items and being too comprehensive, and for average person to fully engage with. So do you have any concern about the drug app being used by services to ask too much? And if so, if it is used to ask in details about every drug someone might use?
Yeah, it's tricky. We're going through that now with the drug app. We're about to do the validation study. It's starting in August. So I think it's more like watch this space. We've designed the survey. Certainly, if someone does use alcohol, tobacco, cannabis, meth, and other things, it will be a longer survey. But I guess it's designed, the drug app is designed as a household survey tool as opposed to a screening item. So at the moment we're doing some, which is kind of a very different thing that a clinician might use in a clinic, for instance. So we're doing some early work. I've been doing some work with James around tweaking the app as a screening tool, so the Grog app. And I think that would just have to be a different, that's a totally different study. In terms of the custom questions that you can add in, that's really, it's whoever is leading the study. So if a different university or health service or community wanted to add in questions, then we kind of advise not too many questions because it just, you know, you need to think about how exhausted and the kind of survey fatigue people feel. For us, it took people around 9 minutes to complete the Grog app, but that includes the outro as well, so the brief intervention. So we found that people were quite engaged doing it because it doesn't feel like a survey. It's very, it speaks to you. The artwork from Franz, from ADAC, as well as James, they're beautiful. So it's sort of, we found that people wanted to stay actually and talk about it afterwards, so that they didn't need to.
Thanks. So for the services who are willing to give the app a try, is there any additional trainings so to help the clinicians to use the app or things like that?
We haven't got formalized training, but I've just been sort of, because it was funded with the NHMRC project, and that's finished now. So we've just been doing that on an ad hoc basis. So if people want to check out the app, and if you've got an iPad, obviously the drug app will don't need an iPad, but at the moment we do for the Grog app. So just flick me an email. So it's just kylie.lee, L-E-E, @sydney.edu.au, and one of our team can send you a link. It is a unique link, exactly like any other app in the App Store. So one link will mean one iPad. There's absolutely no cost just to look at the health promotion version, and we've had a number of Aboriginal community controlled health services that kind of have got the health promotion version. Just say, you know, if someone's waiting in the clinic waiting room, waiting to see their treating health professional, they're kind of just going through and having a look. It doesn't collect data, which is great as well. So it's literally just to get them thinking.
No worries. Thanks for that. And we do have another question. Someone just asked that if there's any brief intervention within built the app, so to reduce the harms for those who are at high risk.
Yeah, there are. So I'm sorry I didn't show all of the user journeys. So Kate, Professor Kate, kind of led the development of that brief intervention. And as I mentioned, it's based on WHO alcohol brief intervention that had already been adapted for an Aboriginal Torres Strait Islander urban population. So there are specific screens for high-risk drinkers, and going into talking about overdose and tremor, delirium, DTs, and so lots of tips there. But we also give those those emergency situations, we also give those tips to the low-risk drinkers and to the non-drinkers in case they're worried about people as well. So it is kind of, but the way we give that advice, it changes. You might be worried about someone, whereas, the turn of phrase changes. It's still the same message, say, about DTs, but we're talking about someone else, whereas for the high-risk drinkers, it's speaking to them. So the app has got a number of different user journeys in there, and obviously it's been amazing, kind of the experience to do the user journey for the brief intervention provided on the Grog app, because you can imagine you've got single drugs, multiple drugs that include injecting drug use as well. So it's been really interesting to work out how we provide that, and yeah, we're in development now. So it's so it's exciting.
Yeah, we'll watch that.